Welcome to the Yale School of Nursing Comprehensive Exam. I have some great volunteers here with me tonight, definitely for your entertainment, of course. They've gone back and forth between who would do the exam, so now we have both. So this will be an instructional video on how you're supposed to do the comprehensive exam. So, who's going to start? Let Carly start.
Actually him.
You want him to start? Okay. You move off screen.
Yay.
Now stand. Okay. So, when we're getting started for the exam, you're going to say that you're going to provide for patient privacy, asking them if they like a drape, if that would make them feel more comfortable. You're going to wash your hands, and you're going to do this exam in a systematic manner. So, starting with the exam, we're going to assess the mental status and orientation of our patient, and I'm going to introduce myself. Good evening. My name is Cassandra. I'm going to be your nurse practitioner today. How are you?
Good.
And what is your name?
Sam.
And do you know where you are?
Yes.
Where are you?
Home.
Do you know what day it is?
What should I say? 27?
Good job. So you only have to assess 3 out of 4 of the ones that are on the comprehensive sheet. But he seems to be in well-oriented state, even though it's homeschooling day number 10. So we're going to start inspecting the hands and the arms of our patient. So we'll take both arms and we'll look at the hair distribution, the texture, looking for any rashes, any lesions on the arm. And then we'll assess the other arm, making sure that we're looking for the same thing on this arm. Looks like he has 2 good arms. Next, we're going to assess the patient's nails, see if he's been biting them. They look pretty good, nice and trimmed and short. They look pretty clean. And then we're going to have the patient make a heart. Have you make a heart. And assess for any clubbing of the fingers, which he does not have because he's a young man. Then we're going to assess the bilateral pulses of the patient. So doing that, you have the patient just relax their arm, and then you're going to palpate the radial artery, and you would do this for 15 seconds and then times by 4 to get the pulse of the patient. Then we would do that bilaterally, so we would do it also as well on the other arm, noting the clock and counting for 15 seconds and then multiplying by 4. Next, we would do the patient's blood pressure. So I don't have a normal blood pressure cuff. I have this electronic machine. So I'm just going to show you the placement of the cuff. So you put the cuff on, and then usually there's a spot where you would match it up with the brachial artery. And having the patient relax their arm in a seated position, you would take your stethoscope, and using the diaphragm of your stethoscope, you would place it on the brachial artery. You would pump up the cuff about 20 to 30 milligrams of mercury, past what you would expect the patient's blood pressure to be, and then you would slowly deflate the cuff, listening for the systolic and diastolic tones. Next, we're going to examine his scalp. Let me get rid of this, put this out of the picture here. So examining the scalp, we're going to look in 4 different areas at a minimum. And we're just going to lift the hair and look at the scalp for any dryness, any dandruff, any lesions, any scaling, and for, of course, lice. Looks like he has a good scalp. So moving on, we're going to assess his visual fields, starting with cranial nerve number 2, the optic nerve. So I am going to have the patient just turn towards me so you guys can see it. And I'm going to have you look straight at my face and tell me when you see my fingers.
Feel.
And assessing the lower fields?
Feel.
Good. So he has some very good peripheral vision. Next, we're going to do the fundoscopic exam. So, get my fundoscope working. I'll have you just turn towards me again. Now, doing the fundoscopic exam, you're going to have your right eye to the patient's right eye, and then your left eye to the patient's left eye. So, gauging, putting your light into the patient's eye, and then moving in to see. And what you're going to be looking for is the red reflex, as well as the vessels, the disc, and the macula. And now we'll do the other eye. Very good. Now, moving on. I have my pen light here. We're going to assess cranial nerve 3, which is the oculomotor nerve, and we'll be assessing perla. So I'm going to have the patient again look straight at me, and I'm going to look in both eyes here, make sure the pupils are equal, reactive to light, and then accommodation. He's got some sensitive light eyes. Next, we're going to assess extraocular movements. This is cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens nerves. So I'm going to have the patient again turn and look at me, and then follow the pen light just with your eyes in an H pattern. Very good. Next, we're going to assess the corneal light reflex. So I'll have the patient again turn towards me, look at me in the eye, and then we're just going to hold the light up and look for the little twinkle in their eye. Looks like he has a good twinkle. Next, we are going to inspect the conjunctiva and the sclera. So this can be done two ways. One, by pulling the eyelids up and having the patient look down, or pulling the eyelids down and having the patient look up. So I'm just going to have the patient, I will pull the eyelids down and have you look up towards the ceiling. And then you're just looking for any redness, any drainage, any inflammation of the eye, any foreign objects. The next thing we're going to do is inspect and palpate his external ears. So we're going to palpate the tragus and then palpate behind the ear. Do you feel any pain?
No.
Now turn this way. Tragus, behind the ear. Any pain?
No.
No. So the next thing we're going to do is the otoscopic exam. See if I can get this catch. There we go. And look in the patient's ears. So because he is a semi-adult, I'm still going to pull back and down because he's not adulty yet. All right then. And you're looking in the ear, if you can see beyond all the earwax, for the landmarks, which are the light reflex, the pars tensa, the umbo, the malleus, and the short process. So I'll have him just turn his ear and I'll do the other ear real quick. All right. Okay, the last thing, my other volunteer wants to come in. Hold on one second. Let's finish this and then you can come in for the next one. The next thing we're going to do is the hearing acuity test, so the whisper test. So I'm going to stand over here about 5 feet away and have the patient occlude their ear that's away from me. So your left ear. Put your hand over your ear. And I'm going to whisper a 2-syllable word. And you tell me what it is.
Ice cream.
Very good. Now I'm going to do the opposite side. All right, do the other ear.
Telescope.
Very good. Looks like he has acute hearing. All right, tap out. So, moving on, we're going to do the Weber test. So using our tuning fork, I'm going to put the fork at the crown of the patient's head to test for lateralization. So, we activate our tuning fork. Do you hear it on both sides?
Yes.
Good. Now, the next test that we're going to do is the Renee test. And that is going to test for it's actually a test for both conductive hearing loss, and you can use it in some assessment for sensory neural hearing loss, but mostly for conductive. So we're going to place this on the mastoid bone and then transfer it over to the ear, because bone conduction, air conduction should be twice as long as bone conduction. Ready? Tell me when you stop hearing it. Can you still hear it? She's got some good ears. Next, we're going to do the nasal exam. So I will take my light, and you could use a pen light if you don't have an otoscope. And I'm just going to look inside the nose, looking for any redness, any inflammation, any drainage that could be present there. Next, we're going to inspect the oral cavity. I prefer my pen light for the oral cavity, and look in under the tongue, at the dentition, looking at the soft palate, and the pharynx. So I just have the patient open their mouth, and we'll just take a look inside, looking to see how those teeth look under the tongue, in the inside of the cheeks, and the roof of the mouth, and the pharynx. Next, we're going to assess cranial nerves 9 and 10, the glossopharyngeal and the vagus nerve, and we're going to have our patient say ah. Say, put your tongue down. Ah. So you can use a tongue depressor if you'd like for that part of the exam. Next, we're going to palpate the oral cavity. So using a glove, I'm going to palpate under the tongue. So I'm just going to have the patient open their mouth. Open your mouth. And with using one finger, palpate under the tongue. Then you want to palpate along the gum line on the inside of the teeth, then on the outside of the teeth, then palpating the roof of the mouth, on the inside of the teeth, and on the outside of the teeth. Next, we're going to inspect cranial nerve 12, the hypoglosseal nerve. So we're going to have the patient stick out their tongue and move it to the side, to the other side, up, down, all around. And then I'm going to have the patient put their tongue inside your cheek, and don't let me push it back. Okay, other side. Don't let me push it back, don't let me push it back. Good job. Next, we're going to test cranial nerve 5, the trigeminal nerve. The way that we're going to do this is to have the patient close their eyes, and we're going to assess with soft touch 3 areas on each side, having the patient tell us when, if they can feel it. You ready? Close your eyes. Do you feel this?
Mm-hmm.
How about this?
Mm-hmm.
Do you feel this?
Mm-hmm.
How about this? Do you feel this? How about this? And to assess the motor function of this cranial nerve, you're just going to have the patient pretend to chew. Chew. Like this. Like you're chewing gum. Good job. Excellent. So the next thing that we're going to do is assess cranial nerve 7, which is the facial nerve. And so we'll have, this is the fun part where you get to have your patient make a bunch of funny faces. So I'm going to have you raise your eyebrows like this. Good job. And then I'm going to have you squeeze your eyes shut as tight as you can. Don't let me open, don't let me open, don't let me open. Then I'm going to have you make a sad face. Smile. And then puff out your cheeks. And then can you show me your teeth? Good job. Now I'm going to palpate the thyroid. So I'm going to have the patient just look up a little bit and swallow. Very good. The next thing we're going to do is palpate the carotid arteries. So on one on each side, have the patient lift their neck. And one on each side. Okay, next we're going to auscultate the carotid arteries. So we're going to have the patient with the bell of our stethoscope hold their breath. Hold your breath, and you're going to listen to each side. Sounds nice and strong. Okay, now next we are going to do some neck range of motion. So I'm going to have the patient follow my instructions. So, ready? So for flexion, we're going to move our chin to our chest. For extension, we're going to look up at the ceiling. And then for rotation, you're going to have the patient look over their shoulder, over the other shoulder. Lateral bending, ear to your shoulder, other shoulder. Very good. Great job. Next, we're going to assess cranial nerve 11, which is the accessory nerve. So we're going to have the patient shrug their shoulders against resistance. Shrug your shoulders. All right. Now turn your head towards my hand. Towards my hand. Good job. Now the other side. Good job. So it looks like cranial nerve 11 is in place. Next, we're going to palpate some lymph nodes. So I'm just going to have you turn and sit towards me a little bit, okay? So we're going to do pre-auricular, post-auricular, occipital. Then we're going to do tonsillar, submandibular, submental, anterior cervical, posterior cervical, infraclavicular, and then shrug your shoulders up, supraclavicular. Great job. Now we're going to palpate the axillary and arm lymph nodes. Are you ready for this one, or you want Sam to do this one? Okay. And now we're going to lift up the arm, and then we're going to palpate in the armpit for central. Then we're going to do subscapular, axillary, pectoral, brachial along the arm, and then epitrochlear right at the elbow. Very good. That was not too bad. Next, we're going to do some arm motions with our shoulders to evaluate range of motion. So we're going to do abduction, which is away from the body. So I'm going to have you lift your arms up like this. Very good. Now I'm going to have you do adduction. Cross one arm in front of your body. Other arm in front of your body. Very good. Now I'm going to have you do some internal rotation where you're going to put one hand behind your back and touch your shoulder blade. You ready? So one back like this. And the other one back like this. Very good. Now for external rotation, we're going to have you put your hand behind your neck like this. Now other arm, put your hand behind your neck like this. Okay, switch out. Ready? So Sam is going to do some active range of motion with the elbows. So he's going to go and make flexion, make a big strong bicep. And then for extension, he's going to straighten out his arms. Now for the wrists, I'm going to have you start with your hands out like this, facing the floor. And then flexion, he's going to point his fingers towards the floor. Extension, he's going to point his hands up for the stop sign. Next, for abduction, you're going to go back to the original position. And you're going to point your fingers away from your body, your wrists like this. And then adduction towards the body. Good job. Now I'm going to have him test his hand strength. So I'm going to have him take my hand like we're shaking hands and squeeze. That's it. That's all you got. Mm-hmm. Next, I'm going to have him stand up and turn towards you guys so you could see. Now, starting at his neck, we're going to palpate down his spine to see if there's any tenderness. Any tenderness? Any tenderness? Pain?
No.
Okay. Now, I'm going to have him just sit down and turn so you guys can see to do the kidney whack. So, using the ulnar aspect of your hand, and you can protect the patient with your hand, you're going to tap on his back and ask him if there's any tenderness.
No.
And then you do the other side as well. Any tenderness?
No.
Okay. Now, stay like that.
Okay.
We're going to do tactile fremitus on the posterior chest. So for the purposes of the exam, I thought it would be fine for you guys just to do the 99 test. So using, again, the ulnar aspect of your hand, you're going to place your hands on the back of the patient's chest and have them say 99.
99. 99. 99. 99. 99.
Okay, no lung consolidation there. The next thing we're going to do is listen to the back of his chest. So here we go. Okay, using a ladder pattern, I'm going to have him take a deep breath every time he feels my stethoscope. Turn a little bit more so people can see. And then not forgetting that right middle lobe. Okay, very good. Next, we're going to have him turn around and auscultate the anterior side of the chest. Oop, I forgot to start up here. Go again. Okay, and the one thing I know that we forgot to do was percuss the posterior chest. Again, using the ladder pattern, you're going to want to percuss in a ladder pattern down the chest. Now, normally you do about 8 on an adult, but since his chest is not as big, you might not be able to fit. All right, switch out. Next. All right, are you ready? We're going to auscultate the heart. Sit forward, please. We only want happy models here. Okay, so using again the diaphragm of your stethoscope, you're going to listen to the heart. So starting with the aortic, pulmonic, Erb's point, tricuspid, mitral. Sounds like a very good heart with no clicks, rubs, gallops, or murmurs. Now we're going to assess for JVD. So normally if you had an exam chair, this would be a little bit easier, but we're going to have her lay back just like that. Now, when you're assessing for JVD, you want the patient to look to the right and using a light source, you'd be able to assess to see if there is any jugular vein distension. I'm trying to see it, make sure you can see it. So having the patient turn their head to the right, you'd want to assess the landmarks, looking for, keep your head to the right, looking for any jugular vein distension. Now, since she's a pretty healthy little girl, she's not going to have any. But if she did, you would take the flat edge and go to keep your head turned, go to the tip of where you see the distension, and then using a ruler, you would measure how much it was to evaluate what the distension is. Next, we're going to auscultate the heart at 0 to 60 degrees, listening to all 5 areas of the heart, again with the diaphragm, and then we're going to be listening to the tricuspid and the mitral valve with the bell of our stethoscope. Okay, just breathe nice and normal and listening to your heart. So aortic, pulmonic, Erb's point, tricuspid, mitral, someone's tired. And then switching to the bell, we're going to listen again to the tricuspid and the mitral. Okay, Bless you. Next, we're going to listen to the apex of the heart in the lateral decubitus position. So we're going to have her turn over on her left side, other side, so that we can listen to the apex of the heart this way. So we'll have her just relax, nice and easy, and you're going to listen to the apex of the heart. Sounds pretty good. Next, we're going to palpate the PMI. So using the pads of your fingers, you would then palpate the PMI. You could do this either in the left lateral decubitus position or having the patient lay back on their back. Again, you can palpate it this way. Okay, so the next thing we're going to do is auscultate the abdomen. So we're going to listen to her belly. She just ate dinner, so let's see how this sounds. Sounds nice and full. Okay. So next, what we're going to do is auscultate the renal arteries. The renal arteries are located about 1 inch above the umbilicus to each side. Let me see where the belly button is. Okay. You still got your pants on backwards? Okay, those sound good. So next, now that we've auscultated, we can now palpate the abdomen. So we're going to palpate the abdomen, first light touch and then deep touch. So we're going to press lightly and ask if the patient's having any pain. Any pain? How about this side? Any pain? How about this side? Any pain? Here? Then we're going to deeply palpate. Any pain? Any pain? Any pain? Any pain? So she had a negative exam and no grimacing on exam. So the next thing that we're going to do is percuss the liver span and the spleen. So to percuss the liver span, you're going to want to start percussing below the belly button. All right, so we're going to percuss here, listening for when we get to an area of dullness. And then we'll mark that spot. And then you want to percuss using the midclavicular line, going down the interior chest till you hear dullness. And then you would mark that spot and you would measure between those two areas to see what the liver size is. A normal adult liver size would be 6 to 12 centimeters, but we don't have an adult here. We just have a JoJo wannabe. So the other thing that we're going to do now is percuss for the spleen, which would be Castell's, the Castell's point. So you're going to have just the patient kind of lift their arm up so it's out of the way. And here I'm going to have you just turn a little bit so people can see. Good. So you wouldn't want your patient to turn, but it's just easier for you guys to see. So you're going to go axillary line here, and you're going to percuss at about the 8th or 9th rib, and then have the patient take a big deep breath and listen to see what you would hear. Okay, negative exams there. Now we're going to palpate the liver. So having my patient lie nice and still, here, just bend your knee a little bit, that should be fine. You're going to put your right hand on the right side under the right costovertebral angle. And then you're going to have the patient take a deep breath. Take a deep breath. And as they're breathing in, you're going to push on down and see if you can feel the liver edge. Usually a healthy, normal liver is non-palpable. So the next thing we're going to do is we're going to palpate the spleen. So what you want to do, so I'm not in the way here, is put your left hand underneath the patient's left side. And then you're going to put your hand here, right below the left costovertebral angle. And again, have the patient take a deep breath and push in to see if you can feel any part of the spleen. Usually, again, a normal, healthy spleen is non-palpable. All right, switch out. to palpate, lay down.
Yeah.
We're going to palpate the inguinal lymph nodes. So the, you're a lot longer on this couch. So the superior one are the horizontal lymph nodes. So palpating the lymph nodes. And then the inferior ones are the vertical chain down. I don't feel any lymph nodes. So the next thing that we're going to do is palpate the femoral arteries. So kind of trying to locate the femoral artery here. Oh, good artery. And then bilaterally on the other side. Good arteries, good pulses. So the next thing we're going to do is then listen to them. So using the bell of our stethoscope, looking for any bruits, we're going to listen to the femoral arteries. Okay, very good. No bruits. So the next thing that we're going to do is inspect these lower extremities. So we're going to look at the skin on the lower extremities for any dryness, any scaling, any scabbing, any bruising, making sure that they look okay. And you'd want to do this on the bilateral leg, and both of them look pretty good. So the next thing we're going to do is pulses on the lower extremity. Ideally, you would want your patient to be laying flat, but my little couch doesn't allow for that. So we'll do I'm just going to have you move your foot so people can see. So you do the dorsalis pedis, and then the posteriotibial pulse, which is right here behind the ankle bone. And then you would do that on the other foot. Again, testing for the posterior, the dorsalis pedis and the posteriotibial pulse. Good pulses there. So the next thing that we're going to do is some hip range of motion. So the first part that he would do is, okay, ready? I'm going to show you. I'm going to have you do some flexion. So bend your knee towards your chest. Very good. Then we're going to do extension. So he's going to scooch on over to the edge with your booty. And I'm going to have you just bend your leg down off the couch. There we go, very good. Then he's going to do some abductions. You're going to extend your leg out like that. Out. Very good. And then he do some adductions. So you're going to take your leg and bring it over your other leg. Very good. And then he's going to do some internal rotation where he's going to bend his knee and your foot away from your body. And then again, you're going to bring your leg back out and then bring your knee back in and bring your foot into your body like that. Very good. He has some excellent hip range of motion. Next, we're going to have him do some range of motion of his knee. For this, I'm just going to have you sit in a seated position. A seated position. And I'm going to have you extend your knee. So bring your leg out. And then that's extension, and then flexion, you'll bend your knee back in. Very good. Okay, now we're going to tag out again. Charlie's perfect at showing us the ankle range of motion because she's a little ballerina. So I'm going to just hold her foot up so you guys can see. So flexion, you're going to point your toes. And then for extension, she's going to pull her toes in. Pull your toes in. Perfect. And then for inversion, she's going to move her foot towards her body and eversion away from your body. Very good. Pretty ballerina toes. So the next thing we're going to do is do the sensory testing of the bilateral lower and upper extremities. So this is where you are going to use a sharp and a dull object. So this is going to be my dull object, and this is going to be my sharp object. And you're going to want to test at least 3 sites up on the upper extremities, comparing both sides, and again on the lower extremities, comparing both sides. So you're going to explain to your patient. I'm going to have you sit up. Now I'm going to explain this to you, okay? Why do you have sad face? You acting? Okay.
Wait, Mom, go in the blue thing.
All right, stop it. This is sharp, and this is soft. Can you tell me which one is which? Are you ready? Close your eyes. And I'm just gonna move your sleeves up. Okay, ready? Tell me.
Sharp, 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 soft.
Okay, and then for the lower extremities. Okay, you ready?
Sharp, sharp, soft, soft, soft.
All right, good job. So the next thing we're going to do is assess bilateral vibratory sensation. So again, using our tuning fork, but this time the 128 hertz. We're going to place this on the bilateral big toe joint. Can you feel this?
Mm-hmm.
How about this? Good job. The next thing that we're going to do is test proprioception. So we want to explain this test first to the patient. So I'm going to move your toe up and move your toe down and tell you which one it is, okay? This is up, this is down. So with your eyes closed, tell me which one it is, okay?
Up.
Now I'm going to do the other toe.
Down.
Good job. So the next one is some deep tendon reflexes. Where's my... So we're going to start with the brachial. So you're just going to have the patient relax their arm. You're going to hit your own finger. Trying to get this response. A little bit. Whoa, that was a big one. And then the radial one on this arm, you just have them relax their arm, relax your arm as much as you can. Look away. There we go, perfect. Let's see the other arm. Again, having the patient relax their arm. Relax your arm. Hey, we've got some good ones out of you this time. All right, and now the knees. See if we can get this a little bit better so you can see the knees. All right, I'm gonna have the patient hold her hands like this. Good job. And the next one, here, move back so your leg is relaxed. Good job. And then the last one is the ankle, which is a little bit hard to see on the video, but we'll try and get a response. Here, just relax your leg. I'll hold it. See if we get a little bit of response. Whoa, that was a good one. All right, now relax this leg. I'll hold it. Whoa, we got some good reflexes going on in here. Then the next one we're going to do is the Babinski reflex. So you take your reflex hammer and you're going to use the handle to go up from the bottom of the foot to the top to see the toes curl. And then this one, it can be ticklish sometimes. So the next thing that we're going to do is we're going to test some cerebellar function. So this one is the fun one where she gets to play a little bit of a game. So I'm going to have you take your finger and put it to your nose and then to my finger, okay? So start with this hand. Put it to your nose. How fast can you go? How fast? How fast? Now try your other hand. She's pretty good. Pretty good. So the other thing that you want to do to test cerebellar function is have the patient go take their heel and run it down their shin. Can you do that? Heel down your shin. Now do the other foot. Very good. Looks like we have some good cerebellar function. So now we're going to have the patient do some gait exercises to evaluate the gait. So I'm just going to have her walk right in front of the camera here, and maybe I'll hold the camera up here so we can see exactly how she's walking. Okay, Charlotte, I'm going to have you just walk. Here, walk more so people could see you. Back over there. Yep, so walk normally. Now walk backwards. And walk on your heels. Now walk back on your heels. You're supposed to walk backwards, silly. Walk on your toes. Now walk backwards on your toes. There you go. Perfect job. Now come on back over here. What? Okay, next thing that we're going to do is the Romberg test. So I'm gonna have you stand up. Okay, and I want you to stand with your feet together and your hands down. Close your eyes, and I'm just going to assess and see if she has any drifting and any swaying in her stance. And it looks pretty good. Okay, the next thing that we're going to have you do, stay standing, is the pronator drift test. We're kind of out of screen here. Okay, so what she's going to do is hold her hands out like this, like a bowl of soup. And then I'm going to guard her again to make sure she doesn't fall. And we're going to have her close her eyes. And we're looking for any drifting or pronation of the hands. So if she had her eyes closed and her arm started to drift and her hand went down, that would be something that we would be concerned about. But she looks good. Excellent. So the last thing we're going to do here is some back mobility. So I'm going to have the patient stand, and you want to make sure that you support their hips during this exercise. So I'm just going to have her lean forward and touch her toes. Don't bonk your head. Very good. And have her stand back up straight. And then, again, supporting the patient, I'm going to have you lean back.
Back?
Nope, I'm going to have you stand up and go lean backwards. Hold in the hips. Very good, very flexible. And then I'm going to have the patient do some lateral bending. So I'm going to have you lean to the left. Very good. Now lean to the right. Very good. And then now for rotation, you want to make sure that you're holding on to the opposite hip and then the shoulder. So if I'm going to have her turn, I'm going to have you turn this way and stabilize your shoulder. Very good. And now hold on. Now I'm going to have you turn the other way. Very good. Excellent job. So that is it. That is the end of the exam. And our two good volunteers. And now I can tell you, definitely even from my perspective, this has been a challenging exam to record, but I hope that it's helpful for you guys to learn some of the aspects of the exam. Remember when you're doing this exam to make sure you have your timer where I can see it. Hopefully you have more cooperative members for your exam. And pillows are definitely way more cooperative. But if you have any questions or concerns, just let me know. I'm available on email, and you can always text me anytime. But good luck, guys, and we will definitely get through this time.
Pillows are handy during this.
Okay, have a good night, everyone.
Pillows are handy.